I think I first noticed a problem with my left arm and my left hand. I found that it was difficult or impossible sometimes to move the fingers of my left hand, and my left arm seemed to be behaving strangely, and I found my left arm creeping up, and I'd think, what on earth is that doing there? And I was able to put it down, but left to its own devices it tended to creep up across my chest.
So Parkinson's disease is the second most common neurodegenerative disorder after Alzheimer's disease. In the UK alone, about 127,000 people are affected by this condition.
The primary symptoms for me are loss of movement, at the moment down my left side. I understand that as the disease progresses, it will affect both sides of my body, but it usually starts off on one side. I go into off periods, even despite the medication sometimes, so I can be engaged in an activity, something simple such as walking, perhaps walking the dog in the park, and then if the Parkinson's reasserts itself, my stride would become shorter. I would tend to lean forward and shuffle.
So we already have treatment available which helps with some of the symptoms Parkinson patients can develop. For example, we have treatment which can help with the stiffness, with the tremor, with the fine finger movements, but we don't have any treatment yet which would slow down the disease progression. We don't have any treatment yet which would stop the illness from getting worse. In the past, we thought that every single patient with Parkinson's disease develops the illness for exactly the same reason. We now know that this is not the case. We now know that there are different mechanisms which lead to the disease in different patients.
If the disease could be delayed in its progression, it would give me more time to do the things that I hoped I would be doing at this stage in my life.
This tool, this new MRI-PET, will really help us enormously to get a better understanding of brain diseases and so many other illnesses. But it will also help us to test new drugs more quickly, and it will really put Sheffield into a fantastic position for future translational medicine.